Okay, welcome, Dr. Mike and Ziegler of Monarch Family Chiropractic. And I love that you are here tonight. And the way that you show up tonight, you can choose to be in a different state, to have more intention, maybe more excitement or more motivation in 30 minutes to have and be a healthier individual. Tonight, we're talking about healthy curves and looking specifically at your neck and how you can correct your neck if you've got any type of degeneration or distortions that's showing up. I think a vital conversation. And I actually love this picture. I think it's a succulent. And when I look at this succulent and you look at the design and just what nature creates, the symmetry, the geometric patterns. Same goes for you and me. We are created in a divine way. All of our structures are there for a reason. And when we deviate from those curves that we should see, when we deviate from the design, we see more stress showing up in the body, more stress showing up in how we experience life. Nothing in nature is linear. When you look at rivers or when you look at land, if you see a straight line, that is man-made. Everything in nature, there are curves. I mean, nature moves where it's allowed to. When you look at a river and how it migrates over time. So I bring that up because when we're talking about the curves in your spine, it is divine, and it is an engineering phenomenon that bridges, that buildings they base a lot of the curves that we see in our spine, they base their building structures on in design to create the strongest structure. So let's get into the neck. So the importance of, let's see, I want to make sure, I'm going to actually close this down and make sure I've got the most updated PowerPoint, actually. As oh yeah, refresh. Where's that? Oh, the refresh in the web. Yeah. Okay, thank you. There it is. Where'd my Zoom go? Zoom folks. Here you are. Sorry, Zoom land. I'm going to share this. Okay, so let's talk about the neck. So the importance of your cervical curve. Your cervical spine is the area in your neck made up of 7 vertebrae. Here you're looking at an x-ray of a cervical curve. This is somebody who's looking to the left. There is, I'll get my tools out. So here's the back of the head back here. It's the eraser. My goodness. Let's try this again. Sorry, guys. Okay. So back of the head, back here, here you see the jaw and the mouth. So this person is looking to the left. And when you're looking at the cervical spine, you should have 1, 2, 3, 4, 5, 6, 7 vertebrae stacked on each other. And it should be a C shape. Actually, should look like a banana. Okay. Here's the spinous back here. So when you feel the bones down the middle of the back, this is what you are feeling. Okay. And here's disc space right here. Right. So those discs should be nice and thick and fluffy. They act as shock absorbers so that as we are handling compounding pressure, they're absorbing shock. So your body can handle that. So it's designed to compress and expand to absorb the weight of the skull. And according to research published by the National Library of Medicine and Surgical Technology, the human head should weigh approximately 12 pounds. So in this design, 12 pounds, no problem, okay? But when we have this spine that looks and is healthy, you've got the vertebrae stacked on each other, well, the disc is intact and nice integrity within the disc. You've seen that C shape of that curve. It allows for flexibility between the vertebra and allows for normal head movement. That optical cervical curve should be between 30 and 45 degrees. And it should be a smooth arc in a forward direction. And if we deviate from that, we can have some stress and challenges. So if we go to our next slide here. So if we look at the numbers in terms of, what we're seeing across the US, is neck pain is the 4th leading cause of years lost to disability. And annual prevalence is around 30%. 50% of sufferers do not find relief from therapies. And 15% of the workforce suffer from neck pain. And if you've heard of forward head posture, also known as text neck or tech neck, it is becoming an epidemic. And it's causing neck pain, arthritis, disc herniation, headaches, arm and shoulder pain, lower lumbar disc, and we're a lumbar spine. This jumps out. Lumbar, disc, and joint pathology, and upper extremity radiculitis. And radiculitis is just a fancy word for nerve pain that is coming from the neck and it's showing up into the arm or into the leg. This is specifically talking about the upper extremity though. So radicular pain is pain that is traveling from point A to potentially point B, being wherever that nerve travels. The vertebral artery is also compromised by loss of cervical lordosis. And lordosis, if we go back here, if we go back here, this curve, when it's looking like that C shape, when it's looking like a banana, we call that a lordotic curve. Okay, the opposite of that, which is what we see in the thoracic spine, is a kyphotic curve. So you can see an increased lordosis or a no lordosis. We call it alordotic because it is completely straight. Or if we see a reversal, that goes towards a kyphotic curve, like in the thoracic spine. So it says, when you see a reduced or loss of a lordosis within your cervical spine, your vertebral artery is impacted. And if your vertebral artery is impacted, that impedes blood flow to the brain. And the brain needs blood flow, right? And we know that that has impacted blood flow and circulation and impacting the structure when your head's out here. Forward head carriage or text neck, okay? So when we have that, let's just go to our next slide here. This is forward head posture, okay? So our head should weigh around 12 pounds. I'm going to jump to the next one. Our head should weigh around 12 pounds. In this far left gentleman or gentlewoman or gentle person, in this far left picture, there should be 0 degree tilt from where that ear is above the shoulder, okay? So that's good, healthy 10 to 12 pounds. Now, as you start to see increased degrees of a head shifting forward, at 15 degrees, we see that head weight goes from 10 to 12 pounds, it jumps to 27. 30-degree tilt, it jumps to 40. 45-degree tilt, it jumps to almost 50. 60 degrees is 60 pounds of pressure on that neck. Well, that's how much your head weighs. So a bowling ball, to put it into perspective, a bowling ball probably weighs between 10 and 15 pounds. So that means that you're carrying, between 4 and 5 bowling balls up here. Pretty stressful. And that's why you see when you have this presentation, it could, we see sports injuries, we see neck pain, disc herniations, pathology in the low back, shoulder problems, all sorts of things. So, according to, again, going back to this National Libraries of Medicine and Surgical Technology, billions of smartphone users spend an average of 2 to 4 hours per day with their heads forward, reading emails, text messages, and using laptops at work. The physical strain on the neck is cumulative and can lead to joint pathology that may eventually require surgical intervention. And more than 30% of people suffer from neck pain each year. So this is a big problem. And this used to be something we were concerned about in just our older population. But we are seeing this in children. And, you know, when we start to see neck distortion and degeneration and these joint issues in children, number one, it's telling us what's happening with the brain and how well the brain is being fed good information through the nervous system. It's telling us how well the brain is being fed good nutrition through circulation and blood flow, but it's also telling us how much stress is on this cervical spine at a young age. And we're looking at what's it going to look like when they're 50 or 60, right? So we've got to be thinking long term here, because this is something showing up in everybody. And I mean, I see it everywhere. Poor posture, this forward head carriage or tech neck. And it's not just here, but we're almost seeing this here. Okay. And that impacts, you know, all the vital organs. So let's take a look at this. So here's a cervical spine. Again, same picture on the left that I showed you. It's just flipped. Sorry, I'm flipping these necks back and forth. So now the guy's looking right. Okay. But I want to show you degeneration that shows up due to life and stress and activities, maybe motor vehicle accidents or injuries. And again, I just want to show you levels of degenerative change that we could see. Okay, so if you remember, the vertebrae should be stacked on each other. What do we see happening right there? Yep, quite the shift. And in fact, you don't even see, now I just put that dot on the top upper back part of the vertebra, so you can see how they're lined up. Oh, we've got a shift here. Then and I mean, to me, look at this space. This disc space looks nice right here. Healthy disc space. Now we're starting to see some change happening with this one below. Okay, 50% reduced here. What's happening with these? Yeah, I mean, you've got really jagged. I mean, we don't even see what's happening in this one, right? And so this is likely years of degenerative change that's been taking place. And we can't, I mean, when we're talking about degeneration, what can we reverse? We can reverse the curve. We can correct the curve and change the compressive forces acting on this spine. Discs, once you lose disc space, the researchers will tell you that is irreversible. We see it in chiropractic offices all over the place that people who start to get adjustments and start doing corrective work, we can see change happening with the discs. But once you have bony changes, we can't reverse that. That is, how can we stop that from progressing? And that's really the what we're looking at today. And the topic that we're discussing is how can we look at correcting this to the degree that we're able to, and stopping, you know, any degeneration showing up, right? This process can take decades. And oftentimes in the first 5-10 years, we don't even feel it. And we have people who come in who've been in car accidents 20-30 years ago, and now they're starting to notice, you know, some heightening symptoms. And we take a look at their x-rays and we see, you know what, this is likely due to what happened to you 20-30 years ago. Okay, so it takes time for some of these things to show up. So, and I want to share this. I mean, I shared this in one of the earlier slides. This is a different research article. Restriction in your cerebral blood flow, so your brain blood flow, may occur from vessel narrowing, clot formation, blockage, or blood vessel rupture, and lack of sufficient blood flow affects brain tissue and may cause a stroke. Okay, so those are looking at the levels of stress when you're not getting appropriate brain, I guess, circulation and blood flow to the brain. So we want to look at, why does that matter in terms of your structure? Let's look at this. This is somebody who has forward head carriage. The person on the left has a healthy cervical curve. The ear is right above the shoulder. That allows for all the tissues to sit totally relaxed and at ease. And when you see that head shifting forward, what does it do? Everything goes taut, everything is stretched. So this is showing you musculature, but you have to also look at a deeper level and say, well, everything in your circulatory, your blood vessels run through there too. Your spinal cord runs in there too. So how is that impacted? I'm switching again. So sorry, they're looking right, now they're looking left. But I found this to be really profound. We attended a conference last weekend, and we were looking at the anatomy of the cervical curve. And when you have changes that take place, like an alordotic curve, a straightening of your curve, forward head posture, tech neck, what is happening to the cord and the peripheral nerves, so the nerves that are exiting out from the cord to the body. So again, I'm going to get my annotation up here. There's structures that I want to make sure you understand what you're seeing. So we're looking at, in this middle picture here, you know, this one right here. This is looking at the spinal cord. Okay, so here's, I mean, it's actually your vertebra, and it's looking at the neck, and it's looking at right here how those peripheral nerves are exiting the spine to go to the body. You have to look at how loose, I mean, just how relaxed are they, right? They're just resting along and resting as they go out into the body. Okay, so we're looking probably along here, spinal cord, and as the nerves are resting to go out here. Okay. If you have a loss of your cervical lordosis, what happens? Stretching and pulling of the spinal cord and nerves. So if you look at this, now I'm going to take this here. Let's clear them all and go back here. Now I want you to, understanding what you're looking at here, if you look at this second picture, I want you to see the stretch that's taking place right where these arrows are pointing. How we're losing this. Right? You have total stretch happening all along this nervous system. This is a big, big deal. You put stretch on a spinal cord that is attached to your brain and brain tissue. Okay, so if you are putting more stress on a brain, that means it's impacting how the brain processes things. I think I've shared this, I don't know how many times with workshops, but attending a continuing ed conference with somebody who, I can't even remember the doctor, but he was presenting research that showed a precursor to chronic disease, especially when we're looking at chronic disease to the brain. That's multiple sclerosis, that's Alzheimer's and dementia. I mean, that's anything you can think of in terms of brain. A precursor to that is tension on the cord, and it doesn't take a lot. 3/10 tension on a cord can be a precursor to chronic disease and stress to the brain. So when we're seeing this level of stretch on a brain, and well, I should say a spinal cord and a peripheral nerve, and a spinal cord is just extension of the brain, it's concerning. And you take it even further, you go to this third picture over here. This one on this first one is how our spine should look, right? You see a curve in that spine. Look at this spinal cord here. You look at how thick it is along here. You know, you're looking at how thick look at that darker tissue and how thick that runs along the canal. You take away the curve in the spine, what happens? Look right here. Look at how thin this is. I'll take that away so you can see it. But look at how thin that is. That is tension on that cord. Look at what's happening with the discs back here. Those are disc herniations. Those are, well, it's a disc bulging. I shouldn't say herniation. That's a disc bulge. So as that curve comes forward, the discs are pushing back into the cord. So some really big concerns in terms of your anatomy and the stress that's being placed on your curve when you see just a postural distortion like a forward head carriage. And how many people do you see walking around like that all the time? Virtually everybody. And how many people do you think should be checked by a chiropractor and start getting work done and look at how can I eliminate the activities, in the intensity of activities that I commit to on a day-to-day basis that are putting you into this posture that are creating this. Now, this is an MRI. Person is looking to the left, and it just wants you to see, you go from, I think conventional MRI is laying down. This could be standing. I actually don't know. Versus an MRI with a patient in a seated posture. And you can see the difference, how the spine straightens. You don't see that curve, and how it impacts the, this might be the same picture, impacts the disc space, impacts the cord. And if you're sitting for 10, 12 hours a day and you're adding that, 60 degrees, that's 60 pounds. No wonder you start to see that disc bulging backwards and that stress on a cord, and it's starting to thin over time because people are doing it 8 to 10 hours a day for decades, right? So I bring this up because, number one, the reality is that we just need to start changing our behaviors around our day-to-day activities, period. There is a reality of folks who say, I have to be at a desk. I have to be and have access to my workstation. Well, how can you create the best ergonomic setup? But even having the best ergonomic setup still predisposes you to stress. And how can you be changing your positions and postures frequently over time? Right? You need to address that day-to-day intense time frame of 8 to 10 hours of being in those postures. Because it's a drop in the bucket when you're just doing one thing here, one thing there, if you're intensely doing this work 8 to 10 hours. One thing that we have been introduced to in the last year is something called the CerviGuard. And it's actually very profound to see some of the changes that we're seeing in a short period of time. This person on the right, you can see how they've got that forward head carriage. You look at where is their head compared to their shoulder. And I'm just going to give you a dot here. So here's their ear. We're looking right there to their shoulder. And we're really looking at this increased curve that we're seeing through their thoracic spine. That's a significant rounding. This guy is not that old. And this is something we see all the time with people. So what the CerviGuard does is it's a collar that you fit on over your shoulders, and it puts pressure in the back and it puts pressure on the front and actually shifts you back this way to create the curve. Okay. Now I'm going to go to my next slide because I want you to see what's happening here. Sorry, this person is now looking the other way. But you can see they have a totally straight curve. We call this a military neck. And this is a picture of their spine with the CerviGuard on. So what it's doing over time. And what we do with the CerviGuard is we start utilizing the CerviGuard 3 to 4 times a week. You have it on for 20 minutes. Most of the time it's very comfortable. There's just a lot of pressure, and we start to ease you into, sometimes people start at 10 minutes, sometimes 8 minutes. Sometimes people say, oh, I can go into 20 minutes. Depends on your age and what's happening with your spine. But we can see sustained changes happen pretty quickly using the CerviGuard. And again, people notice a significant difference when they are, in terms of symptoms, when they're using the CerviGuard. Let's look at this person. So this is Courtney here. And again, you can see that forward head posture that she has on this left side. She's got some curve on that left side, but it's straightened. But when she puts that cerviguard in, what we see happen with her head and how it brings her head above the shoulders. And you can actually see a picture of her posture on this left side after using the cerviguard, right, compared to where she was there. So, and here's another person. Some people think, well, I've had surgery, or I've got fusion. Is this something that I could possibly use? And this is failed surgery syndrome. Isn't that discouraging, right? I think sometimes people think, oh, I'm going to go into surgery. I'm going to have this medical intervention. It's going to solve all my challenges and problems. But we're seeing that there are codes and there are diagnoses for failed surgeries and symptoms as a result of the surgeries. I'm not saying that her surgery was inappropriate. I don't know. This is from Cerviguard. I don't know any of this person's health history, but if we could just get to these folks before they are in that position to need a surgery, right? This person, concerned about using the Cerviguard on a fusion, they actually shifted where the pressure is in the back, so it's right above where that fusion is, and brought her head back, and she got pretty significant relief from her headaches. She had tingling and numbness in her hands. Pretty significant relief there. And just to point it out, I'm looking right here. She's got hardware in her spine, right? So that is fusion of her lower spine right there. So we just shifted, or they just shifted the Cerviguard up to help increase the curve that's happening up through here, because they can't do anything about that fusion there. Once you have fusion, that is not moving. That's a big block in your spine, right? Where you once had, where she once had 3 segments that were moving and able to contribute to motion globally and segmentally, she lost that. So you can only address what's happening above and below that. The Cerviguard is something that we are wanting to utilize more and more in the practice, because it's having much more significant changes in a much shorter time frame. And I think it's easier for people to use than, say, laying on a dental roll and the time frame that you need to build up to using, a piece that introduces corrective care. But if we look at a dental roll, this is something that we have been around for a long time. There's lots of research behind it. But this dental roll here on the left is a foam piece that you lay in a very specific spot in your neck, and it introduces that curve in your spine. And over time, the difference between the Cerviguard and a dental roll, you need to be consistently laying on a dental roll for probably for like 18 to 20 minutes sustained daily for, I would say, 9 months, 12 months, maybe more, for us to see some curve correction. It takes time, versus the Cerviguard is something we can see change happen, 6-8 weeks. But still, you need to be using the Cerviguard on a daily basis, right? It's just where you get those changes. So dental roll is used by quite a few people in the practice to help support curve correction. We're just looking at, are there other technologies and support that we can use that will provide faster results and faster changes? So that's where we're really looking at the Cerviguard is something that will become a bigger part of the practice. This one on the right, this is called the scolagon. If you're this picture, and again with the scolagon, it is a pump that you lay on, and we use this specifically for some people who have radicular pain, neurological pain coming from a disc, because what it does is you use air cells to blow up along the spine. These that wasn't right the word, but the air cells fill up, and when they fill up specifically along your curve, it's actually expanding that space where the disc is, and allows for the discs to, if there's any disc bulging or disc challenges, it just supports the disc health. So that's something that we've used as well. And these are just pictures of the spinal cord and what we see happen when we address the curve and any stress to the discs. So there are tools that we use. All of these are used in conjunction with your chiropractic care. We need to make sure that your subluxations are addressed, you have good motion in your spine, your brain is has less stress on the system. So when we introduce these types of things, it doesn't go overboard. It's not too much of a demand on your system, right? So we need to look at introducing these in appropriate ways as your body's able to handle it. Some we can introduce earlier on, some, we want to wait a little bit, but your re-exams really help us understand where that's appropriate. So really age is just a number. Sometimes we're really assessing someone's posture, and they are in a healthy postural state. They're aligned. We take a look at their x-rays and say, wow, this person's really aging well. And we can see somebody who is, in their 20s in a very different state. I think we can all think of somebody who is a very vitalistic, thriving 60-year-old and somebody who seems like they're 20 years older than they are, right? So age is really just a number. We're not looking at your chronological age. We're looking at your biological age and how are you aging in a vitalistic way, and what's the age of your cellular health, your body from within. And that's where, certainly when we're talking about forward head carriage or text neck, this is something we see with everybody. Everybody should be getting their spine checked. And so that's our challenge to you. At the end of February, we're doing a patient appreciation week. That's where you can send anybody in, family, friends, loved ones, colleagues, coworkers, to get checked at our expense, because we know that people who are under chiropractic care are healthier in the long run, and they generally tend to share what they know, with those closest to them. And so they come alongside and we start to create change within families, and enough families start to change, we see a change within a community. So we need your help. Dr. Kristen and I, Jesse, Kayla, we can't do it alone. We need your help. And we ask that you share what you know. Not everyone, this may be not the right place for everybody, but at least they are hearing the information to start making some changes, or maybe it is planting a seed, right? Can lead a horse to water. Well, they choose to drink. So if you want any more information on any of the modalities that we use here in the practice, please share it with us when you're in next. And we're happy to introduce you to the Deneral or Cerviguard or the Scolagon if it's appropriate. If we haven't had that conversation with you, please have that conversation with us, because curve correction is a big part of the practice. We want to make sure we're addressing the neck before it becomes a bigger issue down the road, or we want to make sure it's aging in a healthy way. So thank you for being here, Dr. Mayakin, Monarch Family Chiropractic, and we'll see you next week as we look into February, Valentine's Day, and our Patient Appreciation Week. So take care.